we're doing it in a program. Milan Shah is here from the Beautologie. I told him welcome, Doc.
Good morning. Good morning, Scott.
Last time you were here, I said I was going to get my wife a gift card from the Beautologie, and I thought there was this. I had this concern that she was going to. Oh, you don't think I'm pretty, or you think my skin's blotchy or horrible or whatever? But she just went ooh. So it turns out those fears were unfounded. I was really pleased with that. So
I'm glad you got her one.
well, I still have to actually do the thing and go do and follow through on it. Which is not my specialty. You guys had a booth at the big deal
Healthy
over
Expo. Yep.
Yeah, a lot of people were talking about that after. Apparently, there was a lot of good information. Women, well, our guys too. It really is a visual thing. If you can show people how that you could go from this to this. That really is an attention getter, isn't it?
Yeah, absolutely. You know, a lot of times with cosmetic surgery, plastic surgery, no one really. You think about what things, what can happen, what things can go wrong. Actually, is what pops into most people's minds, and so there's a lot of questions and there's a lot of concerns and fears. And so when I talked at the Healthy Expo, what I did was I changed up my lecture a little bit, and what I decided to do is pick out the top 20 questions that I get asked the most at the office from new clientele, and I addressed it, and we addressed it with pictures, and I think it shed a lot of light. We had a lot of great questions asked, and so. I think it was very eye-opening for a lot of people.
Well, a lot of people, honestly, because I think this is a legitimate fear. I think a lot of people think of like cosmetic surgery, and they think of Kenny Rogers, or they think about that lady who was the really old woman on the Oscars that scared the crap out of everybody?
Kim Novak.
Kim Novak. There are so many people that overdo this and turn themselves into these monsters. Is there some fear out there on the part of people? Well, I don't want that to happen to me.
That's exactly, the fear on, I would say 99% of people that come in on their mind is, I don't want to look like that one person that's on TV, that Hollywood actor or actress that's gone overboard, or even if it's a friend of a friend that just had way too much done. But what I tell everybody, the truth of the matter is, for every one of those Hollywood actors or actresses that have done a little bit too much, there's probably hundreds, if not thousands, of people walking among us that have had a little bit of Botox,
and you don't even know because they just look really good.
Exactly. So, and so once they hear that, they know, well, yeah, that's true, actually.
Yeah, and I know what that's like because I know people look at me all the time and think steroids, but no, this is all natural as it turns out. When you like nowadays, when we were talking last time, you were on about the lip injections and all of that stuff and the Botox. And is it Botox still the operating term that you use for that? Because there's other stuff now.
Yeah. We term them all as wrinkle relaxers, the stuff that we use for the forehead creases and the laugh lines. It's the stuff that goes after those active muscles, or active expression lines. And Botox is the common term because that's the one that was introduced, 15 plus years ago. There's two other ones that we're using now, Dysport and Xeomin, that have their FDA approval in the States. And they're all great products. It's just, kind of like Coke, Pepsi, Dr. Pepper, they all have their little kind of specialties. Dysport works a little bit quicker than Botox, and Xeomin doesn't have as big of a chance of having an antibody developed to it. So there's a few little tweaks to them, but the majority of these wrinkle relaxers, we mention, we call them Botox.
Right.
Yeah.
Okay, that's fine. No, it's like a thermos. It's not. It's
right.
A name brand and all that. I think that if people, I think there's a whole lot of people that would like to have a little something done to fix some problem. And I think there's a lack of understanding about what happens, and I think that keeps a lot of people from moving forward with that, and shouldn't.
Yeah. I mean, and that's why at Beautologie we got a good team of doctors, we got a great team of nurses, and even the gals that work up front. We're there to give our clients information, and there's no real pressure to getting anything done. We want to make sure the patient's well informed because all too often they really don't know what the best procedure for them really is, and so we actually offer the full gamut of stuff, whether it be non-surgical or surgical. And a lot of times they're thinking they need a major facelift and they don't, or they maybe a little bit of Botox will take care of what they really need a facelift for. And so we just want to give the clients the information, and then with their better understanding of it, they make a much more well-educated decision moving forward.
I was looking at your website the other day, which is excellent. Whoever your web person is Johnny on the spot.
Thank you.
That's well done.
Thank you.
But I saw the phrase, and I started to call you right on the spot. It said neck lift.
Yeah, neck lift.
How does one lift one's neck?
Well, there's a couple different ways. Again, there's the surgical and the non-surgical. Non-surgically, we actually have a laser. It's our skin tightening laser.
Again with the lasers.
Again with the lasers. And so the skin tightening laser works by stimulating healthy new collagen and elastin fibers, and by doing that, that new skin that's coming out to the surface is a little bit more firmer or tighter. Now, if someone's looking for something a lot more dramatic, then I send them over to either Dr. Barnes or Dr. Lehocky in the office, and there is a surgical neck lift where that skin's actually pulled back, the excess skin is kind of taken off, and the incision is done right behind the ears, right behind the earlobe, so it's inconspicuous, and that's going to give them a much more dramatic treatment.
Now, the idea, and I'm sorry for acting this out, it's just how my brain, it's the only way my brain works. You make an incision behind the ear, and then do you just, I guess, lift all of the skin up and sew it back together?
Yeah, I mean, for the most part, it's a little bit more technical.
I don't
than
think
that,
I know that's graphic and horrible, but that's not what I meant. But that's basically what happens.
Yeah, that's basically what happens. I mean, I'm not the guy that does it, so the other two guys in the office it's their specialty. But it's done in a very controlled environment. First of all, it's done in the OR suite, and yes, that excess skin is taken off and tightened up, and there's a little incision left behind the ears. And
well, all I have to go by is because I don't know if anybody's had this done or not, and good for you if you have. It literally, I was looking at some of the before and after pictures on this. I think that neck lift deal does more to make a person look younger than almost anything else, at least in pictures that I've seen. It is a dramatic thing.
It is pretty dramatic, and we're always looking at our face, and the neck, it kind of gets left off to the side, and you're totally right. The neck, is actually it's something that stands out quite a bit, especially when you got that, that we call it the turkey gobble.
Right.
And what's crazy is we're getting a lot more male clientele coming in and doing the neck lifts because that's what they're seeing. They're seeing that turkey gobble. They're seeing that loose skin underneath the neck, and it's so dramatic. It turns back the clock 10 years, if not more.
It really is just a dramatic difference. And the thing I was wondering about, I don't know if this is a part of your business, but people who lose a lot of weight, one of the things that I don't know that they think about on the way through this is when you get done, you're going to have some skin left over. That's just how it is. You ever see anybody that's had like the lap band surgery or whatnot and they end up with all that loose skin?
We see it on a day in and day out basis, as a matter of fact.
Okay, good.
And it's a great procedure. The lap band. I mean, when your BMI is not where you want it to be, you're obese or morbidly obese. You want to get healthy. You want to lose that weight. It's wonderful. You're definitely a step in the right direction. But unfortunately, there's that skin that you still got to deal with. Yep.
Yeah, you're trading looking gross for looking a different kind of gross. And you get up one day and you got like the skin. So that's something that you just like take part of it out and tighten it up a little bit.
Yep, and so it kind of depends on how much we're going after. If it's say a gal that gained a few extra pounds during her pregnancy and she doesn't really have a lot of loose skin, then that skin tightening laser might be the trick.
Right.
Or like you said, if somebody that lost 30, 40, 50 pounds after gastric bypass. They have a lot of loose skin.
Through diet and exercise,
or
however
diet
you
and
lost
exercise,
it.
of course, yeah. Then surgery would be a great way to take care of it. And then, it depends on the area. We have the brachioplasty, which is when you have the loose skin underneath the arms, that gets rid of that skin. If it's the belly, then we're doing an abdominoplasty. So, there's different surgeries to go after different body parts.
No, it's something that if you it's a cool deal losing weight. You look better and you feel better, and you feel better about yourself when you look in the mirror. If you're going to go through that process, whether it's the long-term diet exercise, you might want to keep that in mind. Maybe you budget some, save up or whatnot, because that is another big thing to kind of tighten everything up after you get your skin's kind of loose.
Yeah,
skin's really elastic, but it'll only snap back so far.
Yeah, you're absolutely right. Yeah, you could have said it better. The skin is so elastic, and it also depends on the age of the skin as well. And so elasticity has a lot to do with it. And we kind of tell our patients it's kind of like the icing on the cake. That surgery at the very end it's not the beginning process, it's the end. So you lose your weight, you get back to where you want to be, you get back to the BMI that you want to be, and then we use the surgery to finish it all off for you.
Excellent. Yeah, I would. I'd absolutely recommend that. Man, that was weird. We just hit that camera on hop for a second. What's up with that? We're gonna take. I couldn't do it if I wanted to. We're gonna take a break. We'll be right back. If you've got a question, Milan Shah is here, one of the smartest people in the business. Or you could just go to Beautologie's website, or better yet, stop by. It's a really swanky place. And everybody who works there is really nice too. almost unnervingly nice. Like, what do you do to them that makes them so helpful? We got to take a break. We'll be right back. It's First Look with Sky Cox. It's Bakersfield.com and News Talk 1180 KERN. We live in a unique climate here. We are in the sun a lot here. It's just part of it. The sun will do a lot of damage to your skin.
It sure will.
What can you do to undo said damage?
So there's a lot of different things, and like you said, we live in California, beautiful sunny California. Bakersfield, we get a lot of that desert heat on top of it, and it's serves us right to go enjoy it. We enjoy that sun. Go out to the lake, go out to the beach, and of course we're big advocates of using a good sunscreen moving forward. But what about, the gals that have had all that, sun damage accumulated over the last 20, 30 years? I hear a lot, when I was younger, it wasn't sunscreen, it was tanning oils. And so, unfortunately, a lot of that's taken its toll. It depends on the extent of the sun damage. If it's actually just pigmentation on the surface of the skin, that's actually very easy. If it's those little age spots or sunspots, we could use medicated creams to lighten some of that away, or we can use a laser called a photofacial laser to kind of vaporize or burn those away. Now, if it's a little bit more, the skin itself that's lost elasticity, the texture of the skin.
And doesn't the sun take that elasticity out of your skin?
It sure does. The sun causes what we call free radicals, and these free radicals break up that collagen and break up that elastin, and so the skin is prematurely aging. And so what we need to do is get rid of that damaged skin. And how do we do that? We exfoliate the skin. And again, there's another laser that actually peels off layers of skin and then actually stimulates healthy new skin in its place. And so depending on the extent of skin damage, there's definite ways to turn back the clock a few years or many years.
Wow. Because and you could correct me, maybe all this is wrong or maybe just components of it. When you go out in the sun and you get a sunburn, that's doing proper damage, serious damage to your skin. But that's a lot of it is going to naturally exfoliate. It's going to fall off, peel off, be replaced by fresh skin, but not all of it.
Okay, so taking it a step back, you mentioned sunburn, and that's doing damage to your skin. Actually, let me correct you on that. There's two different types
Told
of.
you have to do that.
There's two different sunlights. There's two different components of UV light. One's UVB and one's UVA. UVB lights is what causes sunburns, and you get that irritation, you get that peeling, you get that redness, and that's actually just, to me, more of a cosmetic thing. Unless you're really cooking out there, you could get a pretty bad sunburn. But that's actually not what's damaging the skin. It's the UVA light that's damaging your skin. That's breaking down your collagen and aging your skin prematurely, and sometimes even leading to things like cancer of the skin. What happens is we buy these SPF 80s, 90s, 110s out there, and we say, you know what, I'm totally protected. I'm not burning. I should be totally fine. I'm not going to get the cancer. I'm not going to get these wrinkles. And unfortunately, it's actually a false sense of security because all that UVA light is still passing through, and you are actually damaging your skin. So it's really important not to buy into these high SPF numbers because it's protecting the wrong type of sunlight. You want to find a nice broad spectrum sunscreen. You want to find something that is protecting everything, that's not bad for your skin, doesn't have a lot of oils that will clog pores, and it's something that you got to reapply. If you love being out on the lake and going out to the beach, that's fine. But you got to remember, no matter what kind of sunscreen you're using, it breaks down within a couple hours, and you got to reapply it.
Right.
You want to use other forms of protection as well.
If you want to learn that lesson, shave your head. You will learn more about how to take care of your skin in a hurry because you have to. If you've never had a sunburn on the top of your head, let me tell you something. It is not pleasant. How many people? Okay, I'm sure when you hear this a lot, especially when you go to one of these seminar deals when you got a lot of women coming by the booth and all that. How many times do you hear, "Well, I want to come do this and this, but my husband." Are there men that are literally afraid to come into Beautologie because it's Beautologie?
Yeah, well, it's changed a lot. 10 years ago, there was a huge stigma of guys getting a procedure that's going to make them, let's just say, look more beautiful. Total stigma. I'll tell you, especially on what I do, the non-surgical side of the practice, where it used to be 1 in every 10 or 15 guys 10 years ago, now it's one in every 5 or 6 patients that are coming in that's a male patient that does either a little bit of Botox, a little bit of facial filler, a little bit of lasering. Hair removal is actually pretty popular at the office. So it's actually becoming a lot more accepted. Now, of course, there's a lot of gals that are still afraid because their husbands say, no, you don't need it, which is great, But the gals are, I tell them, they're doing it for themselves, and usually that's what it is. It's kind of a self-esteem booster if they get to be a little freshened up, they feel a little bit better about themselves, everyone's happy.
Yeah, but you know what, though? And this is actually true. I guarantee you this is true. It's not just about the self-esteem deal. That's a very real thing. It's important when you look in the mirror to feel good about that. That's a really big deal. But also, we live in such a youth-obsessed culture now. It doesn't matter if you're in the classroom or the boardroom or whatever the deal is. Yeah. People, for good or for bad, they want to deal with younger people nowadays.
Yeah, it's the unfortunate truth. I mean, it is the unfortunate truth. And here's the thing: we're working well into our not just 50s and 60s, but sometimes 70s and beyond. And we still feel good on the inside, but our outside doesn't reflect that. And I think that's why non-surgical aesthetics and just plastic surgery in general is become so popular, because now we have a way to kind of balance that out a little bit,
right.
Balance at the outside with the way we feel on the inside.
Yeah, and it really is. And I take it because you think going into this deal, everybody thinks they're gonna, every guy is gonna be able to look like me or Brad Pitt or George Clooney or Don Draper, and you're not gonna make it there. You can't get there.
You're
from where
in that
you are.
Crowd.
Did you notice that I put myself in that group? Did you?
Yeah, I
you
did notice that.
Yeah, I think that's like the top 4. I guess Channing Tatum would be in there. That's fine.
Yeah.
But it really is. I'm telling you, if people think it's just vanity or some crazy deal, if you get up in the morning, you look in the mirror and you go, oh, that feeling, that stays with you all day. It stays with you for your whole life. It could be you get depressed about that thing. But if whatever your changes you need to make, you look in the mirror and you think, awesome. Well, that awesome is going to stay with you all day or all week or for the rest of your life. It really is a big deal.
Yep.
Go down to Beautologie and check out their website. Man, that's well done. You can learn about neck lifts. Milan, thanks for coming in. You're always welcome here. You know that.
Thank you very much.
Bring us
guys.
more
Appreciate
creepy pictures next time.
All right.
We'll give them to Chris. Don't look at Kim Novak and think I don't want to have it, because you don't have to get carried away, but get it done by people who know what they're doing and keep it to a minimum, and you'll just look younger and fresher and hipper and better. Not scary and horrifying like those Jenner people. We got to get a break on. We'll be right back with Lois Henry. First look, Scott Cox, Bakersfield.com and News Talk 1180 KERN.